In the article, The Art of Nonverbal Communication in Practice, published by Raymond H. Hall, PhD. In the Hearing Journal, nonverbal communication can be more powerful and even more influential than what we say with words, and can have a tremendous impact on our success as hearing healthcare professionals. Everyone in this class is learning how to better communicate with our peers, and nonverbal communication can be one of the more difficult areas of communication to master. Dr. Hall states that studies by experts in interpersonal communication show that nonverbal communication constitutes about 70% of what is conveyed in communication. This shows that only about 30% of communication involves the actual words that are used. In his article, Dr. Hall concludes that our body language, facial expression, our voice, and the way in which we present and what we say to others can be extremely powerful. He endeavored to write this article so he can pass on suggestions and practice to aid hearing care professionals in treating and caring their patients. One idea he presented was his 2-minute rule. This was an explanation on how, when one enters in the exam room to see a patient, they have about 2 minutes to make a lasting impression. He explained out the manner of one's stress, how they enter the room, whether they maintain eye contact, and how they move about, if they stood or sat, and the use of small or big gestures would all impact positively or negatively how the patient felt about the care they received. With these ideas in mind, Dr. Hull set out a basic set of instructions on how to hold one's pose, how one should stay calm at all times and speak calmly, as well as how attitude control, voice tone will communicate excitement or anger to a patient. Awareness of the 2-minute rule will allow a healthcare professional to connect with their patient and have a healthier interaction. The next idea he presented was how to identify social space. Dr. Hull states it is important to remember that we maintain an appropriate distance that we are communicating with others. 30 inches is just about right. He explains that when a person is too close, everything they say gets lost as the patient can only focus on the fact that the speaker is too close for their personal comfort. He gives an example of his teenage daughter missing an important point when he was trying to make because he was standing too close in her social space. Dr. Hull also explained that if a person is too far away, it will leave the patient feeling disconnected and give them a feeling of disinterest in their well being. He states that if you are too close or too far from the person you are communicating with, you will lose ground in the effort you possibly get your communication across to them. A third idea he had was body posture and what it reveals about us to the patient. Dr. Hall states our posture we reveals what we are thinking. He points out that sitting forward with your shoulders hunched, elbows on the table, and your head cradle in your hands would give a disconnected feeling. It would imply that you're no longer interested and have stopped listening because you have already made your mind up. He also explains that leaning too far back in your chair with your hand covering your mouth could indicate hostility or the questioning of their logic to the patient. Most people see the covering of one's mouth with it as withholding information or misleading. Dr. Hall explains that he always sets out a basic set of rules for body posture. Standing with feet relaxed about 18 inches apart. The stance will neither give a person about to rush forward or of a person about to flee. It implies you feel safe and confident, and your patient will feel this attitude and feel more at ease. Dr. Hall goes on to give other examples and suggestions on how healthcare providers could conduct themselves in an exam room with patients. He tweaks other areas of nonverbal communication beyond the 2-minute rule and social distance and correct body posture in order to set up a more beneficial applied a system to better communicate with healthcare patients. He does not give a conclusion or sum up of any of the main parts of in this article, but Dr. Hall does leave the reader with a suggestion that looking at a person's nose while they speak, thinking to them, will help keep the conversation from becoming too infinite, but will still show the person that you're concentrating on them. I feel this article did a good job of presenting a simple and straightforward system of steps one could use to professionally interact with their medical profession patients. Dr. Hall used straightforward facts and techniques that left little to be misconstructed and could easily be adapted for use in most other professional interactions with our peers.